Hi, I'm Victoria DellaDonna, and this upcoming fall, I'm going to be a freshman at Miami University. This summer, I had the privilege to intern at Willoughby Hills Family Health Center under the mentorship of Dr. Marianne Samego as part of the Science Internship Program. The title of my project is A Missing Piece of Quality Healthcare, the Application of a Business Model to Healthcare, and its Integration into the Shared Medical Appointment Model of Care. Here's just an outline of the topics I'll be discussing throughout this presentation. So first and foremost, how did the shared medical appointment come about? Well, a doctor by the name of Edward Knopfsinger developed this group appointment because he thoroughly believed that with increasing patient demands for expanded services at reduced rates, today's rapidly changing and highly competitive healthcare environment requires healthcare organizations to look for innovative ways to improve level of service and quality of care while reducing costs. So with that being said, what really is a shared medical appointment? Well, a shared medical appointment, more commonly referred to as an SMA, is an appointment in which multiple patients are seen simultaneously in a group setting. It's most commonly 90 minutes in length, and in the SMA setting, providers see around 10 to 15 patients, with 12 being the national average. During the SMA, 9 to 12 patients are being seen in a medical visit with the same steps as in a traditional office visit, including drawing labs and refilling prescriptions. The provider reviews any questions or concerns the patient may have. Physicians or APNs, which are advanced practice nurses, address each patient individually, and documentation of questions or concerns takes place during this time. Private exams can be conducted on each patient for about 12 minutes, and this is important because during that time, the provider is able to answer questions that the patient might not feel comfortable discussing with other members of the group. Finally, the facilitator wraps up the appointment. And the important thing to remember is that the SMA allows providers to see the same number of patients in 90 minutes as they would normally be able to see in 4 hours, which is according to national benchmarks. So now that the background behind the SMA has been established, what is a business model? So basically, a business model is a plan that a firm develops to ensure that it reaches the revenue it projected, with the business being viewed more as a system. And in this case, the big question is, how are we as a business going to make money to survive and grow? And with that, what does a business model actually have to do with healthcare? Well, with the current healthcare challenges of balancing patient volume with quality in a cost-effective manner and with the less influx of new physicians, the question then becomes, how can quality and patient volume be addressed? And to answer that question, the same or less personnel must be used, which means that resources need to be leveraged. So with the challenges in which we were presented, we sought to derive a solution to the problem at hand by leveraging a business model into the shared medical appointment model of care. So the purpose of this study was to compare the traditional asthma follow-up against the alternative asthma SMA care model, with the hypothesis being that the implementation of the asthma SMA as an alternative mode of quality health care will prove to be a cost-effective model of care. And previous research. During a previous case study, it was determined that those with suboptimal asthma could positively benefit from the asthma SMA and could show positive improvement in the quality of their health. It was also found that 68% of the patients that met the criteria for the study saw a positive improvement in their peak expiratory flow, saw a decrease in beta agonist use, and also a decrease in tobacco exposure. And this research set the stage for the business model because once a model of care is determined to be beneficial from a patient perspective, one must determine if it's beneficial from a financial perspective. When going about changing a current or established process of healthcare, financial impact needs to be assessed, and quality needs to either be maintained or increased. So first of all, a business model was developed and applied to analyze the SMA from a business perspective. The business model of choice was a simple balanced scorecard, and the scorecard was used to track metrics. The scorecard included quality measures, patient satisfaction with the SMA, physician satisfaction, and financial metrics. And in this study, we narrowed our line of vision down to one specific quadrant, the financial portion. The quality quadrant was addressed via a previous study. So then we looked at financial components, and in doing so, a side-by-side analysis was conducted to compare the traditional asthma follow-up with the asthma SMA model of care in two different models, an APN-led model and a physician-led model. And this analysis included an itemization of all costs, as well as the creation of a general formula used to compare the SMA against a traditional office visit. We were then able to use this derived formula to determine when an SMA became cost-effective compared to the traditional office visit. Data regarding the pay rates of different types of healthcare providers was obtained and used in the comparison of the SMA versus the traditional visit. So from this, we were able to determine if the SMA increased efficiency compared to the traditional office visit by tracking the patients seen over the course of 8 hours. Along the x-axis is the type of model, whether it was an APN-led model or a physician-led model, and along the y-axis is the patients seen over the course of 8 hours. The maroon bar demonstrates the number of patients seen on days in which no SMAs were being held, and the lighter color bar demonstrates when the SMA was being held. And as you can see from the graph, in both the APN and physician-led models, there was an increase in efficiency in the SMA model of care versus a traditional visit. This is proven by the fact that on days in which an SMA was conducted, the number of patients that were seen increased dramatically, almost doubled compared to the days in which no SMA was being held. From the data obtained, a generalized formula was created to assess the profitability of each appointment type. As an example, the formula was broken down using the physician-led model of a traditional office visit. The formula consisted of accounting for revenue and cost in order to determine profit. Total revenue was equated to the number of patients seen multiplied by the revenue from that appointment, which varied based on the complexity of that visit. Cost was then determined by calculating the number of healthcare workers needed, multiplied by their rate of pay and the time in which that healthcare worker was being utilized. Profit then resulted from the subtraction of the cost from the revenue. The general formula was used to calculate profit in all 4 of the models demonstrated in the bar chart. Along the x-axis is the type of appointment, either physician or APN-led. Along the y-axis is the monetary profit in dollars. The yellow bar represents the profit made from the traditional visit, and the green demonstrates the profit gained from the SMA. The disparity between the SMAs and traditional office visits in both the physician and APN-led models serves as a clear indication that in terms of monetary profit, the SMA clearly exceeds the traditional office visit. Through a previous case study, it was determined that patients' quality of health could be improved through the implementation of the shared medical appointment. A healthcare business model can be utilized in the comparison of the SMA model of care versus the traditional office visit. The benefits of the SMA are greater in an APN-centered model because an APN is able to double, if not triple, his or her productivity. The generalized formula that was developed can be applied to other areas of healthcare to evaluate the value of an SMA model of care in that disease. The SMA model of care gives providers the ability to see a greater number of patients per day. The analysis that was conducted was very fundamental outline of the financial advantages the SMA has to offer. So therefore, a more inclusive analysis should be conducted to expand upon the greater benefits at hand. The remaining sectors of the scorecard should be addressed via another study. The SMA business model should be considered in chronic diseases such as diabetes, women's health, and weight management, as well as other arenas in healthcare. The generalized formula should be applied to SMAs to gauge their success and benefit because in utilizing a common business approach to a business model, important metrics such as quality, which is essential to healthcare, can also be tracked in an organized fashion. Just references. And I would like to personally thank my mentors, the staff at Willoughby Hills Family Health Center, the Office of Civic Education Initiatives, Ms. Nedra Starling, Ms. Rosalind Strickland, and my parents for their love, guidance, and support. Thank you.